I just wanted to just explore a little bit about what we're seeing and seeing your remarks about an 80% increase for COVID-19. I think this should be and is especially concerning for tribal administrators and programs, nonprofits. We need to know this stuff, and we need to be sharing information with each other. And before I get to my questions, I'm just going to go to 5 things that I've learned in the last few weeks. One is, most recently, we've gone through Orange Shirt Day, led by our relatives in Canada, picked up here in the United States. And there's events and there's information about what Orange Shirt Day is. In basic, if you're not familiar, and most of our audience is though, but if not, it's about boarding school and survivors of the boarding school experience and kind of the historic trauma that passes from that. And it's a day to reflect on what all of that means. So there were events, educational pieces all around there. Wisconsin's seen 2 powwows last month, at least, well, one here in Wisconsin, and they're all informal. And then there was one in Chicago just recently. And then of course, some ceremonies. And I've been able to go to some of these things, most of them, and I just kind of been sitting back and watching, because the concern is this, and it's since we've talked about this in the very beginning, is a vulnerability of tribal populations and tribal behavior, meaning there's an us to the us being Native folks, that we share our lives. When someone's having difficulties, there's a rush of support and help systems that go towards that issue, and that becomes a hub for community support. And it's awesome, but it also becomes a hub for community spread. So I'm just going to take a few moments and just shout out to tribal administrators watching this, because I think the nonprofits in Milwaukee need to have a hats off moment and say thanks to them for educating our community and keeping COVID-19 as long at bay as long as they have. So here's some things that I've learned in the last few weeks at these different events. As a coordinator, a lot of folks are putting these out: larger hand sanitizer, calling them hand sanitizing stations. At every event I've been to where these are put out onto the table, they're not used very often, mostly played with by kids. When an event puts out these kinds of smaller individual use items, a hand sanitizer that fits in a pocket, and they put multiples on tables or are made available where people are sitting in those kind of more public use areas, people are more likely to take this, use it, and take it home with them, which is exactly what you want. So that's one of the tips. And I wish we could make studies on this, but this is an evolving crisis in our community, meaning if you think hand sanitizing stations are the way to go with this, what I've noticed is these are a far better way to go, which is the smaller individual pieces. Dr. Ignace, a comment on that?
Yeah, I would agree. These 2-ounce small bottles, I mean, they're the perfect size for individuals, even within a small group. If someone was to pull this out, y'all can do immediate, hand sanitizer. So, but these smaller ounces, we have been able to commandeer a supply of hand sanitizer, and we are just cranking out these 2 ounces bottles and distributing them to everybody. Everybody who comes in, whoever wants some, this comes with that Safer at Home kit. I mean, I just ordered 10,000 2-ounce bottles. I mean, that's how much I think we will be going through this fall and winter. And I'm probably going to have to order more. They're being used that often, and so we give these out. We've given them out to special events and in support of the community. Take them, use them, individual. Come back, we'll fill it up for you. I mean, we'll keep will keep people, keep their level of prevention at a very high level.
In addition to that, what I've noticed at events is elders really like to use these. And these are these wipes. They can come in flushable or not flushable containers. When those get put out, a lot of our elders like to use those, but then it starts getting passed around. So I just wanted to finish that point by saying these two programs in Milwaukee and around Indian country use these. And if you don't have them, get them. They just because they're used more commonly. And again, that communal behavior really is something in Indian country. Here's another example, and that's singers. At a couple of powwows I went to, the singers are masked. At one powwow, there was public access to the singers where they could come in with tape recorders and listen. So we have lots of people in a very tight area listening, trying to record the singers, trying to get that good medicine for their heart and their soul and all that kind of thing. But then again, what's happening with the singers is a song or two in, the masks are coming off. Even when powwow coordinators at one started doing this, give the singers masks, awesome. Then they come off, then they start handing these out. And these are the face shields. So Dr. Ignace, can you give us kind of a 101 out there for singers that are kind of, hey, powwow committee is going to give you these. Then they take them off thinking this is going to help them because the powwow committee or the event committee gave me these things.
Yeah, those face shields versus a face mask. I will take a face mask every day of the week and 5 times on Sunday. Those face shields don't protect you. We know that the virus gets aerosolized, it's in the air. You know, the face shields won't protect you because it's it's just a barrier to the gross distribution of a sneeze or a cough at you. It's still aerosolized, which means it can get behind the mask, which means you are breathing in the air. It doesn't protect you at all.
The fourth piece of information I'll have you weigh into is this communal food sharing that's so much a part of our culture. A lot of our events, they kind of center around that food share, and that very much, at least here in Wisconsin, is a huge part of our cultural programming and also our regular programming, meaning if we're going to have an event, you're going to have something to share with somebody. So food wise, so at one event we had the buffet table, a buffet style. People are getting food after programs like yours and participating. And I know that when I go to a public event and they're going to have this, I'm bringing my own food in. Also at the Unity Fire, we encourage people that are going to provide food that they provided when they do the ding and dash kind of stuff, where they're dropping food off for our firekeepers. They're individual bags, and that food was prepared individually at a professional place. When it comes to food sharing, what I've noticed is, and what's been helpful, but also a concern, is that it's the prepped food that are pre-wrapped. That seems to be what people are going for. But Dr. Ignace, I'd like you to weigh in on it, because when they come in, let's say this is my energy bar, and they're handing that out, it's all in a basket. Does COVID-19, can that virus live on these individual packets of prepped food like granola bars, sealed cookies, that kind of thing? And again, what's your insight into that on the food share with those individual wraps and committees and folks thinking, yeah, now we got it covered now?
Yeah, I'd be more in favor of the individual wrapped items as opposed to kind of a buffet style. With the individual wraps, what you could do is use the hand sanitizer, open. You would still, could use the outer part, the wrapping of the food as a barrier. but if you use a hand sanitizer, you could take it out of the individual wrapper, and then you would maintain a clean field between your food and your hand. I wouldn't have a problem with that. So individual wrapped items actually would be a much better deal than kind of a buffet walking through the line. I will say that if you are going to do the buffet, that you bring your own plate, not the plate that they actually give you there, but you bring your own plate from your own home with your own utensils that you've brought from home, rather than what's laid out for you to use, because you don't know where it's been. You bring your own plate, fork, spoon. You may be able to, whatever food items you want, but again, you're going to need to use that hand sanitizer before and after, and use your own utensils and your own plates. It's just, that's the cleanest separation you could possibly do.
On that, I think for tribal administrators, that's a must know too, because as I watch the food lines, no matter if the food's individually wrapped or if it's a food line where everybody's hands and they're leaning in and over the food and breathing on it and so on, close proximity to each other, what happens is those that don't bring their plates or don't bring their dishes, they're then communally using paper plates, paper cups, then they're grabbing those things. And because a lot of our folks have families, multi-generational homes, by the time you're about 20 people into a food line or people, hey, I brought my own food, but I forgot my utensils, plates. Yep. There are already 100 hands that have been grabbing onto the paper cups with this, that come in the cylindrical sort of long piece. And they're also handing out paper plates to each other. And there's lots of hands that have touched that stuff. So in a moment, I'm going to grab an example of a plate that I use. But lastly, the fifth thing I wanted to share before I go to the questions, and that was mic use. At a few of the events, what we're having, and I'd like you to weigh in on this because it is a question embedded in it. At one event, they had one mic for one person, and then that's the only person doing the event. But as we know, in Indian country, you have a lot of speakers, lots of different reasons for those speakers to be using a mic. And that mic gets handed across from one person to another to another. So two different ways of dealing with that. One, people have been using wipes to wipe the top of the mic off between each use. Worse is they're just handing it from one speaker to another in group talk. And on another, they're using those foam pieces that go on top of the mic, that cover the mic, and then they'll just pop them off. And then they hand the mic to the person saying, hey, you're all good, you're safe now. And they're handing these mics off to our elders who are in general in their 60s and older. So I'd just like to hear from you about your thoughts about that mic share when people are at events, or what maybe is a better way to do it, because we are having these events. This is spreading in our community. And if it's happening, we need to know what to do differently. Dr. Ignace?
So I would say when it comes to the mic, if I think any handling of the mic, there's got to be a hand sanitizer before you touch it, after you touch it. I think if there's going to be a shared mic moment where it gets passed around, everyone who actually speaks into the mic is going to need to wear a mask. And I'm not talking about the neck gaiters or the face shields. I'm talking about wearing the surgical mask. Whether they take the top spongy foam thing off or not, you're still breathing onto, and some people spray a little bit when they talk. So, and it's the spray of when people talk that you want to prevent from getting onto the mic. So people who speak are going to need to have to wear a mask. you're going to need the sanitizer, sanitize before you touch the mic, after you touch the mic, pass it along. I think just to keep this one item from being exposed or contaminated, to minimize that risk. People who touch it, hand sanitizer before, hand sanitizer after, and if they're going to speak, they got to use a mask. And you know, that would probably be the best possible option to reduce risk. Sharing a mic without a mask, I don't know, and touching it bare hand without cleaning afterwards, it's just increases your risk, and it could be prevented.
And I want to emphasize that point, because all of these places have been taking precautions for people to be safer. It's just a lack of knowledge and discussion, because people want to do the right thing. And I do hope people are paying attention to this, because we're going to be running into this, because just the communal nature of our culture. So I'd like you to weigh in on a couple of things I've also seen at gatherings, people that do bring their own plates, a wood plate. What I've seen people beginning to do is coat the inside of the wood with a polyurethane, something that can be, they're thinking is going to make it safer than just the bare wood itself.
Mm-hmm.
Other folks are bringing these sort of cafeteria style, the old school BIA kind of hubcap looking sort of thing. And there's
those are the best. Those are the best.
So if there's a mom and dad out there, they absolutely have to go to a sweat. They've listened to the program. They know they need to bring their own utensils. Which one would you suggest for them just in the washing process? Because we know these sit in the bags a lot of times.
Yeah, I'd say bring your hubcaps, because they're the easiest way to clean, and sometimes you can, you know, if you're more conscious about disposable, you know, those kind of tin separator plates, those would be the best, because they're reusable and you can clean them. And if you bring it from home, you know where it's been.
And then I want to just spend a special word out there to event coordinators and nonprofits that bring in singers. You know, these guys want to work for you. The women want that sing in those supportive roles. They want to do their best for you. And a lot of times all they'd see is the work of what they want to do to help people feel good, feel better. And they're not thinking and taking precautions for themselves to take care of themselves. So in turn, taking care of everybody around them. Also, we need to remember, and Dr. Ignace, I'm hoping you can address this 80% increase in rise for our population is especially dangerous because of the health disparities in our community. I was wondering if you could talk about where COVID-19 as a virus creates vulnerability in us, and where we are just in general as a Native population with our own health, and why that general health pattern makes us more vulnerable when COVID-19 hits our community.
Yeah, so we know that the medical literature on coronavirus is that it targets two things. One, it targets our immune system, it targets our lungs and our vascular system, our blood, the lining of our blood. It almost takes advantage of our immune system. And then you've heard about the cytokine storm activity, this high response of our body in response to the virus. You know, there is such a thing of too much of a good thing is bad. And this is that example of our bodies of responding so significantly that it actually can be a negative effect on us. And so there are treatments out there, yes, and they are better than better than nothing. You know, they work. They help reduce hospitalization stays, as well as help save lives. but they're not absolute. So we know that high-risk individuals, anybody over the age of 65, diabetes, kidney problems, liver problems, COPD. We know that we have a high population of smokers, especially in the Great Plains area. In the Bemidji area, we have a high smoking rate, high COPD rate. We have high diabetes rates, not just here, but also the entire native population. Some areas are higher than others, but yes, diabetes. We have high kidney problem issues. And so we know that there is a disparity in number of cases per Indian versus all races combined, that, you know, diabetes, high blood pressure, cardiovascular disease, kidney problems, liver problems, lung problems, all manifest itself. And if you have all 4 of these, your risk dramatically goes up. So putting risk of health and the disparities of what natives see currently, in combination of what we know the virus can do, and knowing that a rate of increase in our native population has dramatically gone up by 80% over the last 2 weeks, that's a bad recipe for poor outcomes for our native communities. And I can't stress this enough, of taking this serious when it comes to protecting yourself and your family, and especially your elders and your parents. And so, you know, Mark has touched on this. We all want to kind of get back to some resemblance of our normal life before this. And I understand that. We all want that. But these being prepared to go and being very vigilant about what you touch, where you go, and how you are in terms of spatial relationship to others, you can still be an active individual outside of the home. I think you just got to be absolutely mindful of touching and where you are and where you wear your mask. And you want to reduce those point of contacts, the risk of those point of contacts, as much as possible. So I know, Mark, we talked about interacting in these powwows and how to kind of mitigate reducing transmission of interacting, not just singing, but also in these communal or feast times. And so you just got to be absolute mindful of what you touch and how you are covered, protected wise.
Now, the last piece I'd like to bring to you from a cultural lens before I go to the couple questions that I have heard this last couple of weeks is I was at an event, and I don't want to upset anybody out there right now, but it does need to be talked about. There are namings that are happening. There are healings that are happening, and central to that, at least in the Great Lakes, is the use of something like this. For those of you that realize this is used for education programs that I do. So I'm not showing anybody something that's super secret or any tribal sort of violation here. And of course, that's a pipe stem. And this is what that pipe stem goes into as I'm showing it to you. So my point on this one is, at an event, I have someone in watching who has this, puts that together to do their ceremony, and then declares, as they're going to share this pipe experience with the assembled, that it's perfectly okay for them to be having this pipe brought to them, and that they should smoke it, because everyone knows that COVID-19 is spread through the air, through aerosol, and that because of the sacred tobacco that's inside of here, and I'm not going to question that, but in the burning of it, they're going to be just fine. And so this starts getting shared around the circle, with the assurances from the person saying, hey, it only spread through the breath. You're inhaling something that's warm and at a temperature, and go ahead and do this. So I was hoping you can comment on that, because this is a native to native conversation and we need to address this. Dr. Ignace?
So you said the key word there, sharing. Sharing in the ceremony, sharing in the blessing, sharing in the moment. Those are all fine. Those are all fine, aspects of what you just talked about. It is the sharing of the pipe. It's not so much the smoke, but your lips on the same part that gets shared amongst all of the individuals in that setting. That's where the risk comes in. So it's not so much in the smoke that the smoke from the pipe. It is your mouth being placed on the pipe to draw from, that is being shared from one to one to one. You're basically sharing it. If there's 10 people there, you are 10 people is you. So I think the moment can be shared, and I think it would have to be in a more symbolic nature as opposed to everyone individually drawing from the pipe directly. You're on mute.
So good, thank you. All right, that's helpful. That's why going into the show, I wanted to go through these things, because people are going into a mode, one, where there's a fatigue of listening about COVID-19, two, that now that it's in our community, the community spread is real and happening, as you said, at an incredible rate of 80%. So my last question, because I'm just going to combine what I have, we just have a few moments left, is within these next couple days, within the full moon ceremonies that are happening all over the Midwest right now for our Native people, we'll have gatherings of a number of people. I was wondering if you might share a recommendation on kind of, if there's, not that we would limit it, but when we plan for events, we can have some things in mind. Do we do it inside, outside? Do we plan for, or do we limit our invitations to a certain number? How is it that we do it when we're going to be gathered together for perhaps an hour or more, and stories or conversations are going to be shared? Just kind of a general recommendations going into our full moon ceremonies for our relatives out there. Thank you.
So I think if you're looking at a physical location, let's say inside versus outside, if you're going to do any type of ceremony where there is a gathering outside of your own family, if it's your own family, I don't think there'd be I don't think there will be need for any real precautionaries if it's just your immediate family. But if you're talking about family that don't live with you, and friends, families, relatives that don't reside in your own house, I think you take it outside. Obviously, if the weather is tolerable where it can be outside, you still need to maintain that distance. I know you have the air, you have, distance, you have space, and that's all good, but I wouldn't rely on that as being absolute. So there would still need to be in a setting where you may be outside, wear a mask. Even, being close enough together, a cough outside, if you're in the direct line of that cough, yeah, you would want to have something to protect you before that happens, not after. So if it's going to be moved to an inside venue, I would definitely, mask, hand sanitizer, all of that would have to be, you definitely have to maintain that distance of 6 feet or more. That distance is going to become even more important. Masks are going to absolutely be important. That's, even if it's your immediate family inside, I'd say no big deal. But if you're talking about 2 degrees of separation of your immediate family, everyone has to wear masks regardless of what's going on.
So the last thing, again, I can't emphasize this enough. And again, to the administrators, even if you need to drain these to get to these,
Yeah.
I cannot emphasize it enough. Do it at all of the events. The one thing that I've seen in common is the complete bypass of this and the gravitation towards these, and that these are taken home, and that's not a bad thing. So with that, we're at the end of our program. Dr. Ignace, you have the last word here, and thank you for informative program and putting up with my energy now. It's just, we need to be talking about it, especially now. To me, this is when our nonprofits and our door-to-door workers need to go into these meetings, into stand-up things, being briefed with each other and revisiting every precaution we can, because our community is now at risk even more.
Yeah, without a doubt. And those are good words, Mark. And just looking at these numbers again, no time in COVID history here has the Indian health system been so significantly hit by cases than this past week. Never. Now, before we've talked about, we know what's happened and has occurred in Navajo, and that was kind of an isolated tribal mass outbreak. But we're not talking about just Navajo now. We're talking about every corner of the state, every tribe, every reservation, every Native community, rural, urban, are being hit hard. This is the worst I've seen it. This is the worst I've seen it for the state of Wisconsin, for Bemidji, for all areas. The Native country is being significantly impacted, especially in this past week, mainly because it is everybody. It is all areas, it is all tribes. And, with saying that, I'm still cautiously optimistic that vaccine will come through. I am optimistic that we have therapeutics, and we have therapeutics in the pipe coming through. This is something that I do believe that we will be get through, but we all have to do our own part. We all have to mitigate the risk and reduce the transmission. And at the end of the day, we all have to protect our families. And as a result, we are protecting our own communities. And so I hope the next week is different, and we'll be getting into all of the latest updates and all the numbers again. But please don't be complacent. This is absolutely serious, continues to be serious, and we want to help. I want to help inform the Native community in reducing their risk. So Mark and Jeremiah, until next time, we'll talk again, and everyone stay strong, stay Native strong.